another episode of the Dr. Curry Review. My name is Dr. Alex Keller, and I'm here with my colleague, Dr. Holly Lucille. And today we are talking about blood pressure, hypertension, and cardiovascular support in general.
Yeah.
So lots we can do with natural substances in this regard, but what's going on with hypertension in general nowadays? What are you seeing in your clinic?
Yeah, so I always think this is fascinating when we have this incredible body that adjusts and navigates so much. So I'm happy that my blood pressure can elevate, right?
Yeah.
When I exercise, it's really important. If I am stressed and maybe running from a bear, it's really important. If I need to shuttle oxygen and nutrients to different tissues at different times, it's really important. But when it becomes elevated consistently for a long period of time, I think that's when people get into trouble, and that's what I'm seeing more and more in my practice. Because that sets you up for cardiovascular disease, it sets you up for risk factors for heart attacks and strokes. And I think the things that are informing it, you and I might sound like a broken record on these things, but it's diet, it is lifestyle, it is stress, it is lack of exercise, that is all informing chronic hypertension.
Absolutely, yeah. So, generally speaking, like you touched on, we see a lot of these patterns across the board where the body is trying to do something in response to stress or something else that is stressing
Which
the system.
is kind of life-saving in a sense.
Right, yeah, but it's the issue when you have it at a chronic level, right?
Right.
So let's break down some of these ingredients and some of the products in general. When you're looking at it from a problematic perspective, let's talk first about stress, right? So with stress, what's happening to the blood vessels?
Right, so think about, really truly think about running from a bear. What do you need to have happen? You have to get going, right? So your blood pressure is going to go up because we need more blood to get to your extremity so you can run like the Dickens, right?
Exactly.
So that's what's happening. And if that doesn't, then if the stress is not mitigated, and then that lovely recovery period that we have, or we're supposed to have after stressing events, then this elevated blood pressure continues to stay elevated.
Right.
And you've got hormonal influences from that, epinephrine, norepinephrine, that are all spiking that blood pressure.
Exactly. So if you are trying to address the root cause, but it's not necessarily working as well, we do have ways now that we can increase or improve the vasodilation of the vessels so you don't have as much of that chronic tension.
Right, so that constriction,
Yeah.
exactly.
So L-arginine would be one ingredient that we could use in that regard.
Perfect.
And what's special about L-arginine?
So, well, precursor to nitric oxide.
Right.
So you're going to get that vasodilation effect.
Exactly, yeah.
Yeah.
So that's a really big one. Another one that most people don't know is necessarily specific for heart, but is often used for muscle relaxation is magnesium.
Yeah.
How does magnesium work in this case?
Well, same thing. So magnesium for that the smooth muscle, so of the vessels, you're going to get a little bit of relaxation, right? And what's the number one deficient mineral we have across the board in the United States?
Generally, we assume it's magnesium.
It's magnesium, yeah.
Yeah. So some other ingredients or minerals, I should say,
Sure.
that we can consider are zinc, vanadium, potassium,
Yeah.
sodium, or non-sodium, I should say.
Yes.
Calcium.
Calcium.
Selenium, right? So do they all work in the same way? Are they all vasorelaxing, or could they potentially also have just beneficial healing effects for?
Of course, this is what
cardiovascular system?
I talk to my patients about all the time. We have incredible clinically studied ingredients in natural products or supplements, right?
Yeah.
So, but I teach them that, look, these nutrients that we talk about, like potassium, selenium, all of the things you just rattled off, they're not just in these capsules and used for medicine purposes. They run our biochemistry. If you ever take a biochemical or a biochemistry class, you're taking a nutrition class.
Yeah.
We need these things to have appropriate cardiovascular system running all over, across the board. And that includes blood pressure regulation. So those nutrients and nutrient depletion, I would add, is a contributing factor. So it's the best way to just recover those nutrients so you are working more optimized as a human being.
Yeah, and when you're following a standard American diet, often you become nutrient deficient in several minerals, which can then contribute further to this kind of a condition.
It's amazing, but it happens.
Yeah.
And I see it more and more these days.
So another factor that we see is blood viscosity.
Right.
So if your blood is thicker, then it becomes harder to push through the blood vessels.
So your pressure is going to go up.
Yeah, and a big factor that affects viscosity, aside from just basic hydration,
Right.
is inflammation and oxidation.
That's right.
So antioxidants become a big component of that, and anything that helps to thin the blood. So a good example of that might be omega-3 fatty acids.
Perfect.
Yeah. This product here from Nordic Naturals, Pro Omega CoQ10.
CoQ10.
Again, we're going back to the CoQ10.
Yes.
That's commonly used for heart health as an antioxidant, right?
Right.
So when you get a combination of omega-3 fatty acids CoQ10, you get the benefit of improving the viscosity, but also supporting the heart health specifically.
Right, because that heart, those cells, I mean, and in each and every cell of the body, there is that precursor to ATP. Energy is ubiquitous, or it's ubiquitous. It's everywhere. It's in each cell. And so really important to have that when we're talking about overall heart health.
Exactly, yeah. So let's jump then to talking a little bit about some of the herbs, the botanicals that we can use for heart health as well. Hawthorn is one that often comes up, Crataegus.
Yes, been used like for a long, long, long time.
Yeah, yeah. So the berries or the leaves are often used for heart
Or
conditions.
the whole plant.
Or the whole plant extract, yeah. I actually recently discovered a few hawthorn trees on my property.
Oh, that's great.
They're also absolutely beautiful.
Beautiful.
Yeah, lovely to see. So hawthorn is an ingredient in several combination products that you'll find. So this product, Cardio Blend by Vitanica, or HDN Complex would contain hawthorn. You also have another one, Rauwolfia.
Right, so an Ayurvedic herb.
An Ayurvedic herb, exactly, yeah.
Yes.
So Rauwolfia specifically helps, again, with the vasodilating of the cardiovasculature and with reducing the overall blood pressure.
Right, because you think about, like, let's just think, I think the analogy that I come to is like a hose with water, right?
Yeah.
If you put your thumb over the opening of the hose, so it causes some constriction there, you get what? A greater pressure of the water coming out.
Mm-hmm.
You know, I do that when I'm having to shoot water when I'm watering my lawn all the way across. So I just kind of use it as a tip.
Yeah.
But if that's happening for any reason in your body, and so Rauwolfia is a great example of just being able to kind of, I would say, let those vessels relax a little bit and allow the pressure then to subsequently decrease.
So speaking of Ayurvedic herbs, you know, this is again another area of botanical medicine that is not necessarily as used or as commonly known in Western society, but is becoming much more commonly prescribed.
And the science is there.
And the science is absolutely there, yeah. So in this product by Metagenics, Cardiogenics Intensive Care, and in Cardiotone by Ayush, you have another very key Ayurvedic herb called Arjuna, or Terminalia Arjuna, which is the lengthened form. And there's a lot of Indian research around this in terms of lowering blood pressure overall.
Yeah, and so this, well, magnesium, and then the Rauwolfia is in here as well.
Is in there as well, yeah, exactly. So last thing maybe to touch on is when you're dealing with cardiovascular health, another big component that we always have to think about is oxidation, and antioxidation, especially
100%.
when there's a lot of stress on the system. So what are some things that we can consider that are supportive for antioxidation?
Right, so once again, the coenzyme Q10, lipoic acid I think would be really important. I mean, shoot, I'd get all the way down into the weeds of vitamin C, vitamin E, selenium, all of those things that help reduce free radical stress.
Exactly, and B vitamins are a good component of this as well, and trimethylglycine would be another one to consider. So you've got trimethylglycine in this product by Da Vinci Labs, which is Cardio Benefits, and you've got, again, a combination of the B vitamins with vitamin K and vitamin D, again, very good for blood, for vasodilation, magnesium,
and potassium.
L-carnitine in there. Yep, exactly. And then you've got, when you're looking at these combination products, most of them have vitamin C and a complex of B vitamins as well for that oxidation support.
I mean, it's such an elaborate process, and it does require these vitamins and minerals as cofactors to make all those biochemical reactions happen.
Exactly.
And if you're deficient or depleted in any of them, you're going to start, as we get older, especially in our modern day, coming across these metrics like hypertension, high blood sugar, metabolic syndrome, et cetera. So these are incredible combination products that are going to be supportive across the board.
Yep. Key again is just looking at it from a holistic perspective and understanding that you have to look at the blood vessels, the blood viscosity, and the heart, the health of the heart and its tissues as well.
And it goes without saying that we are, while we're supporting the high pressure and decreasing risk for adverse events, we are working on diet and lifestyle. Because this, that's the funny thing about what we do, I think, is that, and I tell people this, it's not really easy medicine. Here, take this as easy medicine.
No.
Taking a beta blocker or what have you for your hypertension is pretty easy medicine. You go fill it, you take it every morning, and that's your health care. Yeah. When we're working on decreasing all the contributing factors, it's tough for folks. And so we've got to get skin in the game early, and these are some great ways to do it when it comes to hypertension.
Absolutely. Yep, great point. Well, that's another episode of the Dr. Career Review. To learn more about these products and many more, you can visit naturalpartners.com or fullscript.com. And to learn more about the specific ingredients that we discussed today, you can visit our medical education hub at fullscript.com/HCP. Join us next time.